I'm Susan Hunt. Join me for My Health Counts. Colorectal cancer screening saves lives. It's one of those subjects nobody likes to talk about. Of cancers that affect both men and women, colorectal cancer is the second leading cancer killer in the United States. But it doesn't have to be. We'll show you how to take control of your health and reduce your risks. Colorectal cancer screening saves lives. Today I'm joined by Dr. Christopher Bartolone with Gastroenterology Associates, as well as Dr. Andrew Bain with Roswell Park Cancer Institute. And these gentlemen have been kind enough to talk about something that nobody likes to talk about, and that's our bowels. So welcome. It's a great subject, an important subject, because colon cancer is preventable, right?
Absolutely.
I love hearing that. That's amazing. I want to start with some specifics, though. Let's get right into what is colorectal cancer.
Colon cancer is an abnormal growth within the lining cells of the large intestine. They typically start out as polyps, which are benign lesions, but as they grow, they can become malignant, and then they can spread throughout the body.
Mm-hmm. And you shouldn't be afraid. I mean, a lot of people are discovered to have polyps, right?
That's true. Not all polyps are cancerous or precancerous. There are some polyps that are completely benign and that you don't have to worry about. The polyps that we look for when we perform screening are precancerous polyps. If you find those early enough before they're allowed to get bigger, you can remove those and hopefully prevent the development of colon cancer.
Mm-hmm. And over the last decade, the death rate has dropped decidedly, hasn't it?
It has. There's been studies that have come out recently that have shown that the death rate has definitely decreased from early screening.
Who's at risk?
Really everyone is at risk for colon cancer, men and women. It's a very common disease. It's thought that almost 1 in 11 people will develop colon cancer throughout their lifetime.
That's crazy. That is an incredible number. So it's very important to know your risk factors and certainly to get screened. I want to talk a little bit about risk factors because there are those that you can control and ones you can't. So what are some you can't control?
Well, you can't control your age, and
Yes,
people over the age of 50 are typically the people that we think about it as most at risk for developing polyps or colon cancer. A family history of polyps or colon cancer, especially in first-degree relatives, such as children or siblings, parents. So it is certainly important to know your family history. A personal history of inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. A family history of, there are different types of polyposis syndromes.
Is that genetic syndrome?
Those are genetic syndromes that will put you at increased risk at a younger age. So it's definitely important to know that. Ethnicity, race, and African Americans are definitely at increased risk for developing polyps and colon cancer, again at a younger age. So we typically start screening African Americans at the age of 45 as opposed to the age of 50.
So 50 really is sort of the benchmark, if you will. That's when you really should start to get a serious screening. But there are reasons to be screened when you're younger if you have different risk factors.